I am your host today, along with Claire Callison over from APA, who is our co-host. We are so excited about the discussion today. We'll be joined by Dr. Kelsey Gerbig from Humane Rescue Alliance and by community member Denita Brown, who has worked closely with Dr. Gerbig. And I'm guessing Sydney has also worked closely with Dr. Gerbig as well. The topic today that we are going to be talking about is how their small team has made such a huge impact as they go out into their community and provide supportive medical and veterinary services to their community. So I'm just really excited as we kind of have everyone pile in. If you have any questions, please feel free to post them into the chat. We will hopefully have some time on the back end, so I'll try to get us started as quickly as possible. You go ahead and post those into the chat, and whichever ones we have, the most of or that we feel are pertinent to the conversation, we will try to pull those out and prioritize those for discussion. So as always, we do want to start with the question of the day. Please post your responses in the chat. Are there any specific initiatives or programs in your community aimed at providing veterinary care to underserved pet populations? So this can include everything from low-cost microchip clinics, vaccination clinics, low-cost pet hospitals, groomings, pet food pantries that provide different supplies, whatever it is, go ahead and post that in the chat for us. Let's see what we got. Thank you, Allison, for posting that in the chat. I'm seeing pet clinics and low-cost spay neuter. What else are we getting? TNR. We are seeing mobile vets. Vincent says multiple mobile vets. Kelly with Operation Kindness says low-cost wellness clinics, which is really big in the communities as well. Wow, you guys are way faster than I can be right now.
I know there's a lot of great programs in here. I see some vouchers for spay neuter as well. Oh, I like it. Find, fix, free fun. TNR. Lots of TNR here.
Which is amazing. Shop clinics, more low-cost spay neuters. I'm seeing dentals. Wow,
This is huge.
it is. I didn't expect it to kind of go so quickly or to have so many responses, but that's great that so many organizations are supporting their communities in a variety of different ways. Everything from food to medical assistance. I'm even seeing pet deposits included in there. So I just think that's absolutely amazing. Kudos to all of you who are working with organizations that are doing this absolutely amazing work to support your community.
Yeah, this is wonderful. I love it. Definitely in the theme of our presentation today, which is great. Hopefully we're feel free everyone to scroll up and get some ideas. There's lots of great things I'm seeing also vaccine clinics and also including surgeries and dentals for pets for different pets in underserved areas. This is great. Thank you all. Well, yeah, and I know a few people are joining us. Just to reiterate the question of the day, are there any specific initiatives or programs in your community aimed at providing veterinary care to underserved pet populations? So we're getting some ideas coming through the chat here. So definitely keep those going. So welcome. Happy Monday to everyone. If you're just now joining, we have a pretty full schedule today. So we're going to move into national updates. And just as a reminder, if you have a national update, feel free to unmute. You can raise your hand or just go ahead and unmute. We just asked if you could keep it under a minute so we can get through all of them. And then if you also want to put your national update in the chat, we'll be watching for that as well. So that being said, we'll open up the floor for any national updates.
Hello, this is Vincent with the Maddie's Human Animal Support Services Project. All of you who are part of any one of our job alikes, you can either proactively reach out to me or also you can I will be sending emails to our job alikes members. We are looking for people to help us plan this year's job alike. So we want to start small committees for each one of the job alikes, the planning and the facilitation for this year. So I'll put my email address in the chat, and please send me an email if you're interested and you're part of one of our job alikes.
Hi, everyone. This is Jennifer Comas Phelps from the Humane Society of the United States. And I'm just reminding everyone that our advanced registration deadline is upcoming for Animal Care Expo 2024. Expo will be in San Antonio this year from May 15th through 18th. And February 22nd is the last day to save $50 off registration. So we invite you to go ahead and register by then. Thanks.
Hi, everyone. I'm Emily from the Correct Shelter Medicine program at UC Davis. I wanted to let you know about a free virtual 2-day solution sharing summit focusing on getting animals back where they belong. Over 20 speakers will come together to share return to home interventions from the field to your shelter's front line. The summit is next Wednesday, February 21st, and then the following Wednesday, February 28th. And a huge thank you to Maddie's for making this possible. Your one-time registration will give you access to the entire event, including the recordings. So make sure you register, check out the schedule, and share. I also wanted to let you know about the What Found Feels Like contest, where you can share your photos, videos, and stories of pets at your shelters going back home for a chance to win one of two $100 gift cards. The contest closes on February 22nd, and the winners will be announced at the closing session of the Back Where They Belong Summit on February 28th. I'll drop the links in the chat. Thank you.
Hi, this is Erica at Maddie's Fund. Applications are open until the end of the week, until Friday for the online instructor-led courses. We have 10 offerings this semester, and they'll run in March with weekly meetings. They include transport, shelter clinic management, humane education, pet support services, and many more. And I'll drop the link in the chat.
Hey everyone, Amber Eby from Maddie's Fund here. I dropped the link in the chat as well, but just wanted to remind everyone that the Open Arms Challenge application period starts on February 26th. And if you have any questions about getting into your grants portal or how the challenge works, Irene and I are always happy to talk to you at grants@maddiesfund.org. Thank you.
Okay, that looks like all that we have for national updates. Again, if you guys have any others that we were not able to get to, please go ahead and post that in the chat. There will be a transcript posted on the Maddie's Forum thread, so you will be able to see all of those national updates and links going forward. So I want to give as much time as we can to our speakers to get their presentation out to you all, as well as to leave some time on the back end for Q&A. So if you can please join me in my very warm welcome for Dr. Kelsey Gerbig from Humane Rescue Alliance, who will be taking us through our presentation, and the wonderful Denita Brown. Like, I always do my research on our speakers because I'm like, who are these amazing people that are happening? And y'all, Denita can cook, like not just cook, but she can cook. So just want to give huge kudos to the amazing work that they do, the amazing partnership that they have, and from what seems the friendship that they have developed from this program. So I will turn it over to you, Dr. Gerbig, if you want to take us away with the presentation.
Great. Thank you so much. And thank you everyone for joining today. We're just so excited to share our work. We just had our 1-year anniversary. So just super jazzed to talk about it. Just give me 1 second. I'm gonna pull up our screen here. Let me see. Okay, cool. So today we're going to talk a little bit about the Field Veterinary Program here in DC. And just to kind of get started, I want to do some just brief introductions. We're going to talk a little bit about how the program started, what exactly we're doing, and then I wanted to leave a lot of time for discussion and questions because we are a very new program. To our knowledge, we're the only ones doing something like this in the United States, situated within the Field Services Department here at the Humane Rescue Alliance. So I wanted to talk about that if anyone had questions. And I thought that originally I was going to have a big presentation with data and graphs because I like that kind of thing. But then I was talking to Lawrence a little bit, Lawrence Minnis, and I decided to take it back. And so this is going to be kind of a picture show. We're going to tell stories. Denita's going to chime in and talk a little bit about how we got connected with her, and how we've helped Sydney. So there'll be lots of pictures, I promise. Just bear with me as we get started with the first few slides. So I'm Dr. Gerbig. I have a background in small animal private practice. I graduated from Ohio State University in 2016. Got my feet wet in private practice, both in Michigan and here in Virginia. And then we had the chance for me to join the Humane Rescue Alliance about a year and a half ago-ish. I also have a strong interest in global health and community medicine, so I'm very passionate about the work we do for that reason. And no presentation would be complete without me sharing all my pets, and we have quite the zoo. I am the proud owner recently of 2 African dwarf frogs that I adopted from the shelter, and so that's in my lower right-hand screen. And Denita, I'll let you take it away.
Hello, everybody. How are you doing? Oh, no. Oh, yeah. Oh,
We're doing great. Welcome, welcome. There's
So I'm the proud. Sorry, it's the nervousness. So I don't know where should I start exactly.
Tell us a little bit about yourself to start, and then we'll jump into Sydney's story in a couple slides.
Okay, so my name is Denita Brown. I got Sydney about a year or two, well, actually almost 2 years ago. She is one of my additional babies. I'm currently pregnant as we speaking, and we have literally got another 8 babies, puppies. More to love. Don't get me wrong, more to love. But yeah, Sydney is my big baby. She is a big girl. I thought she wasn't gonna be a big girl, but she is a big girl.
Yeah.
Right now I'm just coping with everything, and Sydney is growing, and her birthday's about to come up, so we're about to celebrate in a couple of days.
Exciting.
Get a doggy cake. Gotta find a doggy cake. So yeah, that's what's just going on right now.
Great. Well, thanks, Denita, for introducing yourself, and I will have you jump back in a couple slides because I really want to talk about Sydney as kind of a star in our story, because that's how we got connected, and that's how we've continued working together, which is great. So basically, the Field Veterinary Program started again January 31st of 2023. I was hired by my amazing boss, Chris Schindler, because he recognized the need for veterinary care in the city. Specifically, he was seeing officers, our humane law enforcement officers, animal control officers, being presented with situations where, an animal didn't necessarily need to come into the shelter for care. It would potentially be something that we could treat at home. So he posted a job summary, I applied, and here we are. So I'm so fortunate to be at the Humane Rescue Alliance doing this work. Before the program started, and I'm going to show you a map here in a second, but there are a lot of areas in DC without veterinary clinics, and I'll show you that specifically. So folks that needed care but couldn't physically get to a veterinarian because maybe they didn't have a car, or maybe they couldn't leave their home, or if they were financially struggling and couldn't afford the high cost of veterinary care, there weren't a lot of options for them except to potentially surrender to the shelter. And that was stressful for animals, right? Having to leave their home and the people that they're familiar with. And that was really stressful for the owner because they had to sign paperwork saying, I'm going to give this animal up to receive some basic care. And the language was scary with that sort of paperwork. And there's also that time associated with transporting the animal to the shelter, the time that our shelter staff potentially were taking care of animals, and the money associated with that, all the hands taking care of the pet. And so we were trying to come up with a program where we could kind of help step in and prevent animals from needing to be unnecessarily surrendered to the shelter, and doing that kind of in a low cost and efficient way throughout the city. So this is the map that I told you I'd share. The blue dots are veterinary practices across the area. And for those of you who aren't familiar with the geography, I'm going to use my mouse here. With this dark black line, those are the bounds of DC. And so as you might see, the kind of cluster in the middle here, and then we've got fewer blue dots here on the edges. The other thing to note about this map is that it's colored in this way because the darker the red, the higher the social vulnerability index. And so this is a neat tool that we use to look across the city and see where the need is the highest. And so we definitely know that kind of in these regions down here, and if you imagine the Anacostia River kind of along here, so we always say south of the river, but I would say the majority of our time is spent helping clients kind of in this region here. But the Field Veterinary Program, we bop all over the city. So we see people wherever the need is. We always tend to start our day kind of down in here and then work our way back up north as rush hour gets worse and worse. So we've learned a lot by being on the road, and we try to be very strategic when we see things. So this is when we first started. The program was built literally out of a van. So this was our mobile office to begin with, and that's me on the left. And then Ellen Kurland, she is currently a humane law enforcement officer, but she was part of our team in the beginning because she thought she might want to transition a little bit away from humane law enforcement work. So she joined our team, and this was our very first day. And then the picture on the right, we didn't have any champagne that I could like crack on the vehicle to initiate our first day. So instead I used squeezed cheese because I love positive reinforcement. So we cracked open a can of squeezed cheese and anointed the car and got started that day. And the program took off on the 31st. And this is what our office looks like. It's a little different now, and I'll show you a video in a second, but I've got my computer on my lap. We've got a mobile printer. If we need to print out rabies certificates on the fly, we've got a can of squeezed cheese in the middle, and then plenty of coffee and water, because as we move around the city, it's not always easy for us to stop and take breaks. We are making a mental map of good places to use the bathroom around the city because we don't have one of those in our vehicle, but we bring what we need as we move around the city. And so this is our new vehicle. We were really lucky to upgrade to a Ford Explorer earlier in the year, and we took that sticker and got it made into kind of the full side of the vehicle. So we try to be very easily noticeable. And it's really fun now that we're branded like this. I will say probably at least once a week, someone pulls up, honks at us at a light, rolls down the window, and it's a community member that we helped maybe a month or two before. So it's neat that we're being recognized in the community for sure. And let me see if this video works. And oh, I'm gonna turn the sound off though. So this is this was a video that our social media person recorded a couple weeks ago, but I liked it because you can kind of see what the back of it looks like. We have Wi-Fi in the car, which is incredible. I can do my notes as we move throughout the city. We have that portable scale, which is heavy, but it does the trick. We just can't do anything less than a pound. Let's see if I can go back again. We have a refrigerator, which is a cooler. It does the trick for right now. We have a thermometer in there to make sure that we never get above a certain temperature for our vaccines and other cold drugs that we carry around. We have a pharmacy right now. We're using these toolkits to organize our drugs, and that is the work of Stormy. Stormy is featured in the beginning of this video. She is our current field services technician, and she's a rock star. She spends a lot of the time making sure that we have everything we need for the day, and she's very organized and had this great idea to use these toolboxes and has labeled everything, as you can see. So she's a huge asset to the program. We also try to get things from the shelter that are donated so we can pass them out to the community members. Sometimes that means carrying a couple extra bags of food. We like to share toys and leashes and harnesses when we can pass them out. We bring e-collars because that seems to be something that is really needed, especially for some of the things that we treat. So whatever we can find at the shelter, we try to stock our car with so we can pass it out to people that we see that are in need. Let's see here. So when the program first started, we got clients from a couple different facets. And so the aim of the program was to support the field services program. So our 24-hour dispatch team here at the shelter gets calls 24/7 for folks that maybe have a veterinary question or they're to the point where they don't have any other options for veterinary care, so they reach out to dispatch instead. And we have a giant Excel spreadsheet that we keep track of the calls, and dispatch takes them from their spreadsheet and puts it onto our spreadsheet. And that's how a lot of times we connect with community members. And that's kind of how it all started. But again, we work very closely with our field services colleagues. So we get referrals from our humane law enforcement officers, animal control officers, and animal control investigators. for a variety of things. And we'll talk about some of those stories. When the program first started and we were trying to get our schedule filled, we worked closely with referrals from other departments as well. Our pet support team is incredible at the Humane Rescue Alliance, and if there was something that they felt that could be treated in the field, sometimes they would punt that case to us, and other times where it was something that we couldn't handle in the field because it needed surgery, we would reach out to them. So it's been nice to work with other programs at the shelter. And then lastly, word of mouth. Now that we're a year old officially, people know about us. Dr. G and Stormy are I wouldn't say common household names, but people know about us and they tell their friends, and we'll talk a little bit about this more. But it's nice to start being known in DC as a resource for clients. But as our capacity has filled up, we've had to take a little bit of a step back, and we're not able to take referrals from departments right now. And we're really just trying to focus on the referrals from the other 3 ways. So now I kind of wanted to get into storytelling because no one likes looking at texts, especially in the middle of the afternoon when you need your second cup of coffee. So I wanted to show some cute pictures, but also talk a little bit about some of the things that we can treat in the field and how we got these cases. So we'll start with Nana. She is this cute, well, now she's much older, but when we first met her, she was this little nugget, like 4-week-old kitten. And this community member reached out to Animal Dispatch because she was in need of veterinary care. She had never owned a cat before. She was given this cat by a friend, I believe, and she was doing her best, but the kitten was having kind of chronically loose stool, was scratching at its ears, and she wasn't sure kind of what was normal and what was abnormal. So she reached out to Animal Dispatch, and then Dispatch let us know. We received her call on our spreadsheet, reached out to her and found a good time to meet her at her apartment. So this is us in her living room, kind of getting to know our little patient. So we took a look at her and she was actually doing really well. The owner was doing a great job kind of bottle feeding with kitten milk replacement. She had already gotten some advice from a friend about starting to make that slushy pate mixture for her to play with to start weaning her off of liquids to some sort of kitten food. So we did a full exam. We found out that she was really well hydrated. She was super curious. And in the end, incredibly cute. So we kept in touch with her, which was really great. Had a couple more follow-up visits to make sure that she was gaining weight and that all of her kitten questions were answered. And so the owner, has her set up really well with litter boxes, a ton of toys and enrichment. She's a very popular cat. When we went to go do this exam, several neighbors popped over just to make sure that Nana was okay for her first vaccine. So we got her set up with her first feline distemper vaccine. We dewormed her a couple of times because she had that round kitten belly. We provided some toys for her just to make sure that she was staying busy and not scratching furniture. We taught her and her neighbors how to do nail trims on their cats, which was something that they had never really didn't know how to do. So we made sure they had the right tools for that. And then we just answered some general questions about cat behavior. One of her concerns was that she was growling a lot, especially when she was playing. And so we answered or asked some more questions and figured out that Nana was actually purring. And so it was really great to be able to let her know that she was doing all the right things. And she is like doubled in size already. So she's at the point now where we referred her to our other programs at the shelter, our community vaccine clinics, and we hope that she's going to continue to do those vaccines. But her owner knows that she can always give us a call if she has questions or has a hard time finding something. So now I want to talk a little bit about Sydney, and Denita, if you want to jump back on and talk a little bit about your girl and how we connected, and then we can talk about her escapades throughout the city of DC and how we reconnected, if you're cool with that.
Okay. Sorry. Sorry. Okay. Well, unfortunately, my story with Sydney starts a sad one. In the first year of me having Sydney, I lost someone very close to me. And when I went to the Humane Society, I was looking. Oh, yep. And when I went to the Humane Society, I was looking for something or someone to fill that hole. And there she was, my Sydney Whitney. Sorry, right now she's playing. Over time, Sydney developed these red bumps from outside, so I'm guessing it had to be an allergy from the summer. But then her ears started to turn red and she kept scratching them till they bled. I took her to a well-known vet but the cost is very high. Just to look at Sydney, it was $95. And when the vet told me that I have to pay per test to see what she has had, it was very discouraging, especially seeing how Sydney looked, and she looked very depressed. I felt I had no hope. So I called the Humane Society, and when I called, the dispatch lady told me that there could be somebody to come and look at Sydney at no cost to me. And honestly, I didn't want to because I didn't want to be judged, because most of the time people judge you when they say you don't take care of your animals. But in line, I was taking care of her. I just didn't know the allergies. So when Dr. Kelsey showed up, I was afraid of being judged. And when she looked at Sydney's skin and her ears, she knew exactly what it was. She understood what I was going through. Dr. Kelsey solved Sydney's ear infection and her skin infection. She has never looked this good, and she's back to herself. Months go by, we gain a new family member named Diamond. And both girls, I'm not gonna lie, I thought they would not get along, but they got along great. And someone decided to open my front gate and let both of them out. 2 weeks later, Diamond shows up, but I was still waiting on my Sydney to come home. I get a call from Dr. Kelsey saying that she has Sydney and she's ready to bring her home. And when I say those words, it made my stomach boil. Like, I was so happy. I was in tears. And I honestly thought nobody would bring her home because she's so friendly. She loves everybody. I thought Sydney would never come home. And later we welcomed 8 American bullies. Yes, Diamond had babies. And all the care for my dogs I get from Dr. Kelsey, I am so grateful. This program has helped me in so many ways just to keep my little family together. I wouldn't know what I have done emotionally if she wasn't there, Dr. Kelsey. So I just wanted to say thank you, Dr. Kelsey and the Humane Society, for this program. You don't know how much you impacted my life with joy. And Spike. This is Spike, the big boy.
Oh,
Spike, you want to say hi?
They're the cutest puppies. And Denita is such a special community member, and I love her story, and I love working with her because, one, she takes fantastic care of her animals, and two, it's just so great to be able to, I mean, the fact that we were able to get Sydney back to you, Denita, is just one of my favorite things that we did during the first year. The reason we found Sydney after her escapades when she got loose is because another community member found her on the street because she was so darn friendly and took her in, and we found out about that appointment through dispatch. Stormy, I'm gonna go back to this picture for a second. Stormy and I went to go see her because the owner was concerned about her skin flaring up. And as soon as we walked in, Sydney immediately recognized us, and we saw that she had a space guard. We microchipped and found that she matched you, and we were able to get her home that same day. So I just love, one, I love working with you, and two, I just think that this story is a great example of how we initially connected through dispatch, but then also word of mouth in the city, and making those relationships, we were able to continue to help. And we absolutely love coming back and looking at those puppies. And so we've gotten them set up with their first vaccines and deworming. So Denita, we are obviously going to be back in a couple weeks for another recheck for those babies to make sure that they continue.
I know.
I know, like I said, I want to leave a lot of time for questions, but I do have a couple more stories to share. So you just cut me off if we're going over time, but I'll try to be quick. Oh, this was the last picture of the puppies. Again, I just wanted to show a lot of cute puppy pictures. I want to talk a little bit about our connection with humane law enforcement as well. This was actually our very, very, very first patient with the Field Veterinary Program. Penny came to us through the work of Officer Ellen Kurland. Again, she was the technician that first started the program with me, and she actually had met Penny through an HLE call. And we were able to connect with this owner where really he needed a couple things. We didn't have a picture of Penny from the time, but Penny was suffering from demodectic mange. And so one of the things that we see a lot, like with Sydney, we see a lot of dogs with skin infections, and a lot of times those end up being mange. And so we were able to treat Penny through our connection with the Humane Law Enforcement Officer. And this is what she looks like now, beautiful shiny hair coat. We got her hooked up with Bravecto, which is a 3-month flea and tick prevention that we use off-label to treat certain types of mites. We tested her for heartworm, got her set up with prevention. The owner also needed some help with food, so we gave him a bag and told him about the pet pantry, which is another thing that the shelter does, which is amazing. And then this girl liked to be off leash, and so we made sure that she got fitted with her own leash and harness, but she still likes to do zoomies in her front yard, even with that harness on. So Penny is one of my favorite patients as well. And then lastly, I wanted to talk a little bit, because this is a recent case that we had. This baby, her name is Autumn. She is a 6-month-old little pitty. And we connected with this owner through word of mouth last week. So one of the things that we do a lot of in the city is parvo treatment, because we see a lot of parvovirus in the city. And we are working on crafting an outpatient parvo treatment plan, because the shelter does not always have the capacity to take in every animal that tests positive for parvo. And like what we were talking about with Denita, the cost is very overwhelming, and oftentimes prohibitive for owners to go to private practice. And so this little lady was found, her neighbor, actually the owner's neighbor, saw this pup out in the yard, and it just so happened that we had treated that neighbor's dog a couple days previously for parvo. And so that gentleman was able to recognize the signs and symptoms of parvo, knew about our program, told this owner who to call, and then we went out the same day to test this baby. She came up positive for parvo. And so she looks a little funny because she's got that fluid bump. We taught the owner how to do sub-Q fluids, got her hooked up with Serenia, an anti-nausea medication. And this was just last week, so we're going to do a follow-up this week to make sure that she's successful. But I have not heard anything from the owner. And so I'm assuming that she's doing well. We have a fairly high success rate with our outpatient parvo treatments. I hesitate to give a percentage because we don't have a ton of numbers yet. But I can only think of one dog that we had to euthanize within the past couple of months, because by the time we got there, it was too late. And so this is one of my favorite things to do, is actually to treat parvo in the field, especially when owners are interested and willing, and they can be a key part of the treatment plan with us. So wanted to leave some time for questions. I know it was a lot of storytelling, and we didn't get to go into all the specifics, but I wanted to kind of give everyone like a brief insight as to what we do on a day-to-day basis. So yeah.
Thank you both so much. I'm such a crier, and I was like trying to hold back tears as I'm like hearing the stories, because they're so cute. So if you saw me go off camera for a couple of seconds, just don't worry about it. But we do have some questions that are coming into the chat. So let me go ahead and get those queued up for you. There were some things that I saw that I just wanted to point out in case you guys didn't see them, but the feedback is people are generally impressed with this program. So much so in just the work that you guys are doing. Denita, everyone's commenting about how much they just love you and your laugh and your just contagious energy. So I did want to highlight those things because I think that those are very important to this call. Also shout out to Lawrence, Bobby, and Irene, who are in our chat, answering some of those questions as well. So some of the questions we did have come through. Do you set up a site? So someone asked if you set up a site, or do you have a list of people to visit on a particular day? So how are you kind of generating who you guys visit?
Yeah, that's a great question. So we use and I should say, like, all the softwares we use, I'm not paid by anything. I don't support anything. These are just what worked well for us. Maybe there would be something else that would work well for you. But we use a software called Acuity. That was something that the shelter had used for some of the community medicine programs. And it's specifically made for like small businesses. So when we get that phone call, we make them an account in Acuity, and we block off time to see them. It has been a lot of trial and error. big shout out to Stormy. She has a very good spatial awareness of the city and neighborhoods, and has been instrumental in helping us kind of cluster appointments. And certainly when we do receive calls, and this is something I didn't go into a ton, but we triage the calls. So we have different levels. And so things that are more urgent, like parvo, for instance, we are going to see same day, and we will make exceptions like to get to those people. But otherwise we do try to group things in different neighborhoods, so that way we can maybe see 3 or 4 houses and, you know, within an hour and a half or so. And that definitely helps us optimize our time in the field. So yeah, we see people where they're at in the city, and we don't have a site currently. We just go to them.
Thank you.
Yeah, go ahead, Shawnee.
I was going to say, I just love that, you know, you guys are looking at it from the strategic point of going to multiple houses in the same location to hit as many people as possible. I think that's great that you guys are maximizing the resources.
Yeah.
Okay, Claire.
Yeah, agreed. Thank you so much. There were a lot of questions about funding and the origin of the program. So obviously you're with Humane Rescue Alliance, but that was one question, is just some background. Is the program originated from the shelter? And then how did you all get started? It looks like there's a lot of folks that are really interested in either doing this at their organization or providing, you know, some guidance to another shelter that could implement this. But can you give a little background on how you all got started and maybe some tips on the funding piece?
Yeah, absolutely. And I wish Chris was here, my boss, because he was really kind of the mastermind of creating the program and hiring me from the get-go. And so, and I will say, maybe stay tuned, because we are going to be presenting at Humane Expo, and I think that we'll have a lot more data and specifics, so that way we can share with other folks. So that'll be coming. But we are, and I should have mentioned this originally, we are a free service to all DC residents, which is super nice. The funding comes from grants and donations. And so that's something that we're working on, is, you know, always applying for grant funding and that sort of thing. I don't know if I could share more specifics other than that. I will say that we found, and again, numbers are being crunched, but we roughly run about $33 per visit in terms of medications, diagnostics, and supplies. So it's very cost effective. And that's when we take an average of all the supplies that we use and divide it by the number of patients that we see during a period. If you take into account our salaries on top of that, I don't want to give the wrong number, but I believe one of the last times we did it was about maybe $150 per visit. Again, we'll have more numbers, I think, once we finish our end of year like data reporting. But the initial numbers that we have looked at show that we are a very cost-effective program in terms of keeping animals out of the shelter. So I'm very proud of that.
That is great. So another question that we got, and I again believe it was touched on in the chat, but was this, it talked a little bit about the social vulnerability map. Is that visible for them to see, or is that something that they are able to run on their own organization, or do you have any background on how that was achieved?
I don't know if I can speak specifically to that. If Bobby's on the call, he was the one that originally introduced me to that, and that was created before I joined the team. So he would probably be a better resource in terms of, like, you know, sharing that and where that information came from.
Okay, and for those that were curious about that, I did see that Bobby posted some information on it in the chat as far as the funding that went into being able to create that. So once it is all transcribed, it will be posted on the forum if you guys want to hop over there and then tune in a little bit on that info as well.
Sounds great. There was also some questions about, I'm jumping around just a little bit, but about parvo treatment at home. So I know not every puppy or every canine patient may qualify, but did you want to talk a little bit about that? And it looks like some are interested in starting a similar at-home program, and if you had any SOPs to share on that. I don't know if you want to talk a little bit more about parvo.
Yeah, absolutely. I love talking about parvo. I guess SOP is something that we're currently putting together. I have a cheat sheet right now that we give every owner, and I've got some Excel spreadsheets that I'm working on to keep track of cost per patient. So I'm happy to share that once that becomes a little bit more finalized, because we are still pretty new in treating it. How patients qualify. So it depends on the situation, and I think first the patient has to be not on death's doorstep. If we saw one patient who was severely dehydrated, anemic, really dull and lethargic, and unfortunately, we did not feel like that would be a good scenario to try to treat this at home. And so we have to make those decisions in the field oftentimes of what we feel might be successful versus not. And the other thing that I should say is I do always let owners know, coming as a veterinarian, I give everyone the gold option, and I let them know that if, the best way to treat parvo is in hospital, and I always make sure that they know that. But I let them know that our limitations of the program and how we can help. And folks, like I said before, are really interested in learning how to help their pet. So we also have to gauge interest of the community member. And if the owner is not interested in learning or comfortable with giving sub-Q injections, we have to either troubleshoot and find someone else maybe in the household that's willing to learn, and we work as a team to teach that. I haven't come across anyone that isn't really excited to learn how to do it, which has been great. Even if they're afraid of needles, usually a partner or a sibling will come over and help with that. And then, the big four things that we do, and I don't want to get into the nitty gritty of it, but I'm happy to talk, about this with others if you want, but, fluid therapy is important, anti-nausea medications, and then we do treat with antibiotics to, in the fear of bacterial translocation. And so those are the big four things that I tell people. Sometimes we'll add on dewormer, but I try to limit all the information that we're going over with them, because it is very overwhelming for folks when they've just been told this very scary diagnosis and then given the option to treat at home. It can be very overwhelming. My technician and I are getting really good at kind of dividing and conquering. So normally what we do is when we suspect a parvo patient, we enter in with our suits on, and that picture that I was sharing with the tackle box that was covered in that white foam, that's the tackle box that's easily disinfectable that we take into houses that we're concerned about an infectious disease. We test the patient, and then once we know that they're positive, or even if they're negative and we still suspect parvo and we're going to treat otherwise, Stormy is a great teacher, and she does a great job showing folks how to give IV fluids, all the tips and tricks that we know. We talk about the sterility of the needles and making sure to change in between. And then while she's going over that part, I run back out to the car, take off my garb, and then I work on getting together a treatment protocol with dosages, pre-drawing up syringes, counting out meds, that sort of thing. When we go back in, we check for understanding, making sure that the owner is comfortable with everything that we're doing. We give them a chance to ask a lot of questions, no question is off limits. And then she's already gone through the sub-Q fluid part with them. I sit down and go through everything again with them. So we've been able to really, I'm very proud with our protocol, and we're learning, and there's still stuff that we're kind of changing and making, more available to clients. So it's still a work in progress, but really excited about that we can do that in the community.
I am blown away by you two.
Thank you.
There's no other way to say that other than absolutely blown away. I do want to open the floor for individuals who may have questions to unmute and ask Dr. Gerbig or Denita themselves. So if you do have a question, feel free to raise your hand or unmute and jump in on the chat. Otherwise, we'll keep kind of going through the list of questions that we have here. I'll give everyone a couple of seconds.
Good morning. My name is Juliana Lutin. This is a little bit unrelated. My project is in Guatemala, and I'm reaching out to dog lovers if anyone knows of any veterinarians or services that are available for countries outside the United States, as I'm having a hard time getting that. Currently, I'm paying for most of the sterilization clinics. It's about $50 for the packet, but I'm still struggling trying to find some help. And I understand there's some veterinary students, or maybe UC Davis has a program where vets are, they travel to other countries. Do anyone know anything about that?
So someone just posted in the chat to check with Veterinarians Without Borders. So if you want to kind of note that, you are also welcome to post your email into the chat if you feel comfortable, or onto the forum, Maddie's Pet Forum, which will be linked as well, just to see if anyone wants to, if anyone has any resources that they can reach out to you directly as well.
Thank you.
There was another resource posted up above. It says oh gosh, Unidos para los Animals. The founder is Linda Green. Julie Lanai posted that.
I will look at that.
Here, I'll copy paste it so it's the next one up.
Hi, Suliana. Hi, this is Julie. Hi.
Oh,
yeah.
good.
You may want to check with Linda Green. I'm a trainer, and she is a friend of mine that she had a rescue down in Guatemala. It's called the Unidos para los Animales. And she has a, I don't know, it's a friend or someone, a vet that would come down and help with spay and neuter from time to time. I don't know it's a regular thing, but maybe 3 times a year, 4 times a year, or something like that. You may want to reach out to them and see, you know, they may have some pointers that might be able to be helpful.
Thank you so much. I've talked to them too, and they are in Antigua, which is about 2 hours away from my place for my dogs.
Okay.
But and also my organization is a 501c3 nonprofit in California.
So you are in California. Okay.
Right.
So is her nonprofit. Her nonprofit is in California, but she lives in Guatemala. She married to a Guatemalan. And so she lives in Guatemala. And so, you know, so that I know that she has some sort of connection between California and Guatemala, and that might be helpful. I'm not sure.
Okay. Well,
Yeah.
thank you so much. I'm Guatemalan, and I'm married, but I live in California since I have to work here to pay for my dogs. So but I'm trying to find resources so I can do more for them. So thank you so much for the information.
You're welcome, and thank you for what you do.
Hello, everybody listen. Can you hear me?
Yes.
Yeah. Okay, my name is Miriam Martinez, and I am from Charleston, South Carolina, and I am from Bogota, Colombia. And actually, I am raising money to go to Bogota to do the same thing, but we had to raise money here, and we got to pay over there to the vets, you know, because over there is so expensive, and they need money, you know. So the good thing I can tell you is to raise money in your community, in your own community. We have a party for Colombian people. We're gonna get money, and we're gonna go over there, and we're gonna do it maybe in September or October, depend of the money that we can get by the time.
Oh, thank you so much, and good luck.
Okay, thank you. I will let you know, okay? But it's a good thing, okay?
And feel free to reach out to me. I'm gonna put my information there, since my project's about 3 months old. They will already sterilized 127 dogs. We already have a vet that gives us a good price. I just feel I need to find more resources.
Okay, good luck. Okay, but let me know, okay? And I will let you know.
Thank you so much.
Thank you all for sharing that. And yes, please do put your email address. You can either direct message it to each other, or you can post it in the chat for those to reach out. Bobby, I see you have your hand raised.
Oh my gosh, all this collaboration just warms my heart, Shanya, and it's good to see you. And Dr. Gerbig and Denita, I just wanted to personally thank you for telling the story of the work that you're doing. And my conversation is related to funding. I think I just wanted to sort of expand that discussion, because I think there's 2 things that allow us to make this happen at Humane Rescue Alliance. One is thanks to folks like Maddie's and PetSmart and other donor or funders. but also we have shifted our strategic initiatives to focus on keeping families together. So from a place of philanthropy, it is one of our primary goals. And so for the last 2 years, we have been having these conversations with with our community every single day about these are our missions. We have been telling Dr. Gerbig's stories and Denita's stories, and we have actually seen an increase in the level of philanthropy that we're having related to these sorts of programs. So if you are willing to invest in telling these stories, our community has been receptive to that. And the other thing I'm going to mention is for many of us as organizations, the most expensive asset that we have is our labor, right? So the staff that we're currently paying right now is the most expensive asset. And so if you are invested in this type of work, I challenge you to look at your current staffing structure, your veterinary structure, your capacity for care, and see if you can actually start delegating some of that time to programs like this. Because it doesn't just start with having a full-time vet, it starts with starting to introduce yourself to the community and starting to develop those relationships. So if you can start with that, prove the model, show the need, the money will come. So I'm just incredibly honored to be here with all of you and super excited to see what all of you are going to do in the future.
Thank you, Bobby. Thank you, thank you, thank you. It looks like we are right at the hour, so that means we are just out of time. Hi, Madeline. I know, I'm so sorry. If you want to go ahead and post it in the chat, we would greatly appreciate it. We do have to cut just because we're right at 1:50. I did want to go ahead and just thank all of our speakers. Everyone that kind of tuned in, Dr. Gerbig, Denita, we are so grateful for your expertise, for your experience, and for sharing with us. Please do not forget to run over to the forum where the discussion will continue, but we greatly appreciate all of you. Have a good one, you guys.
Thank you all.